Hey, happy Tuesday. It is Topics and Tips Tuesday. I want to talk about the new AACC and AHA guidelines for hypertension management. We have discussed this before as it was released earlier in the year, but I still receive questions on this, so I want to revisit it. Also, having new followers, I want to go over it for them as well. So, for those of you who don't know me, I am Dr. Brittany Weinstock, founder and president of the Nursing Studio. I created this about 5 years ago to assist nurses and nurse practitioners with being successful on certifying boards. I utilize the tactics that work for me to incorporate into teaching for others. I have assisted over 2,000 nurse practitioners with being successful, and I would love to have you to add on to that list of successful test takers. So let's get into our topics and tips for today. So the new ACC and AHA guidelines for hypertension management are really simple, and I don't want you to overthink it. As you know, with JNC 8, we have parameters, and they were based on age and comorbidities. Well, with the new guidelines, we don't look at age anymore. And so the thing that you should know is we go back to the main thing that we've always known as nurses. 120 over 80 is the number that we want. If they're over 120 over 80, it's considered to be in a pre-hypertensive stage, and you want to start doing lifestyle modifications at that time for everyone, being that you want to incorporate diet and exercise, a DASH diet being low sodium diet, low cholesterol, and telling them to exercise at least 5 days a week with 30 minutes on each of those days. And then if their blood pressure is 130 over 90, that range is for those who have comorbidities. So, let's think through it as we always do. If you have a comorbidity, of course, we want your blood pressure to be lower because we don't want to increase any of your risk factors for heart disease. So, if these patients already have diabetes, they have high cholesterol, or any other health issues, that's what I mean when I'm saying comorbidities, then you don't want to add hypertension as an additional risk factor. So their goal is 130 over 80. If it's anywhere higher than that, then you want to initiate therapy. The therapy does not change as it was with JNC 8. So thiazides, calcium channel blockers, ACEs, and ARBs, those are our drugs of choices. Drug of choice for hypertension management, and it doesn't change for this. Now, for those people who are healthy, they don't have any comorbidities, no illnesses, then their goal blood pressure is 140 over 90. So if it exceeds 140 over 90, that's when you initiate therapy for that population. So for people who have comorbidities, 130 over 80 is their goal. If it exceeds that number, then we need to initiate hypertensive management therapies. If they are healthy, no matter what their age is, 140 over 90 is the goal for that population. If it exceeds that goal rate, then that's when we'll initiate therapy. We still follow the same treatments. So again, African Americans respond better to thiazides and calcium channel blockers. So those are still the medications that are the go-to if this is an African American patient. For non-African American patients, you still can use all of the medications, thiazides, calcium channel blocker, ACEs, and ARBs, and remembering that our ARBs are utilized for those with chronic kidney disease and diabetes to protect their kidneys, okay? All right, I will meet you back here next Tuesday for our Topics and Tips Tuesday. Bye.